Hi guys, I hope you're all doing well. I know that many of you who follow me and the work that I do will be finding the whole coronavirus situation incredibly anxious, but also in particular because you may be considering getting pregnant at this time or have had treatment scheduled in order to do that. And you may be aware that there's been recent news that's come out through various different colleges and associations around the world, but most recently from the UK, regarding new guidance that is essentially telling us to postpone and defer all non essential or non urgent fertility treatment. So, before I go into a little bit of detail as to why this guidance has been given, I just want to draw out the wider context of what coronavirus actually is and the impact that it's having. So, the pandemic that we're experiencing at the moment is completely unprecedented. The number of cases that we're seeing all across the world, the number of people who are ill and who are suffering from it are also increasing. And we are on essentially the steepest part of that growth curve, which is demonstrating exponential growth at the moment. And we are all essentially on the NHS preparing to face a critical crisis that will arise in the coming weeks. Now, we are dealing with projected figures at the moment, but we are anticipating that the burden that the NHS is going to have to face will be considerable. And we are having regular meetings and making provisions in order to be able to cope with this and this unprecedented crisis that none of us have ever witnessed before. Now, as a result of that, there have had to be some very, very difficult decisions made on ethical grounds in order to try and do the best by our patients in order to protect their well-being and their health, as well as any potential babies who are made as a result of any treatment. And essentially, what this all boils down to is the fact that this is a new virus that is very contagious, that is spreading rapidly, and the effects of which we don't fully understand yet. So, at the moment, when we look at the number of pregnant women affected with COVID-19, the cases are mainly from China. The number of cases that we're looking at are just over 30, almost 40 in total. It's not a big number, but overall, what we are seeing in terms of the effects that the virus is having is that there isn't anything completely critical or complications that we're seeing which are not salvageable. And most of all, the data is very, very reassuring in terms of the fact that really the only complications we've seen so far are potential preterm births, which have occurred in a few of the situations, but we're not sure whether that was to do with COVID-19 infection or whether the decision to deliver these women was as a result of something else. And we've also seen one baby born with COVID-19, but actually the baby tested positive 36 hours later, and it is thought that actually this wasn't due to vertical transmission, so from mother to baby, i.e. through the placenta, but was probably either during the delivery or afterwards, the environment that the baby was put in. So overall, this has been reassuring and we haven't seen any much bigger complications than this. However, because we don't fully understand what this virus is capable of yet, we have to take an incredibly cautious approach, and we have to understand that the reason pregnant women have been placed into the vulnerable group of people, including the over 70s and those who are immunocompromised with chronic medical conditions, is because women who are pregnant have a level of immunosuppression as a result of their pregnancy. And therefore, if they were to get something like a flu virus, then they could potentially develop complications from that, and that these complications could have an effect on their babies. So this is why we are being cautious, and also because all of the cases that we're seeing so far affected with coronavirus have all been in the third trimester, as this virus hasn't been around for that long. So we're yet to see the effect in the first and second trimester. And sadly, we're only going to be able to see evidence of this as time goes on. We don't fully understand the effect within the first trimester, whether it increases miscarriage rates. We're hopeful that it doesn't, but when we compare coronavirus with previous viruses, let's say the SARS virus, SARS did cause an increase in miscarriages and also had an effect on fetal growth. So this is why it's important, and why the Royal College of Obstetricians and Gynecologists has also recommended that any woman who is found to be COVID-19 positive is going to be given an ultrasound scan 14 days later in order to be able to check on the baby's growth. So what we're essentially doing is monitoring and following up what happens to anyone who is affected. But if you are pregnant, I don't want anyone to panic, because, as I must stress, the cases that we have, though the numbers are small, overall have shown us very reassuring results and effects which haven't led to any serious complications that we couldn't treat. So that is the good news. However, because we have to remain cautious, and in particular because we don't understand too much about the effects in the first trimester, we also have to apply and project this kind of scenario to patients who potentially want to get pregnant. And the British Fertility Society on the 18th of March came out with a statement to say that essentially all non-urgent treatment should be deferred until a later phase. We don't quite fully understand when treatment will be able to resume, when we're going to be in the safe period. So at the moment, everything seems really a little bit up in the air. And I do understand that this is going to cause, and has caused, an incredible amount of frustration, of anger, of hurt, of pain. People who have waited a long time to have this treatment, people who have pinned all of their hopes on this, people who have taken out loans and investments to be able to afford it, people who secured funding from the NHS in order to be able to have it, people who are a little bit older and feel that this is perhaps their last shot. And I do understand all of this. We all do, as obstetricians and gynecologists and fertility specialists. It's a really, really difficult period of time for us all to deal with. And whilst we're trying to balance all of these anxieties that you might have, we're also trying to make decisions which are in your best interest and in the best interests of any babies that are born. And because we can't take any risks with any of this treatment, this is why this heartrending decision has essentially had to be made. Now, if you are in the midst of treatment, whether that is IVF, IUI, ovulation induction, whether it's egg donation, then this is something that needs to be discussed with your individual doctor to see how to proceed, because every case is different. If you have got symptoms of COVID-19, then the strong recommendation is to essentially stop and abort all treatment, because of the fact that if you were to go and develop this infection, there could be complications that may not just affect you, but also your treatment and potentially your baby too. Now, if you are well, then this is something that has to be decided with you and your doctor as to whether you carry on, and then any eggs which are retrieved or embryos which are created are essentially frozen, and that is the recommendation, not to go ahead with any fresh transfers, and certainly not to start any new cycles of treatment where the situation is classified as being non-urgent. So what makes a situation urgent? Well, essentially we're talking about cancer cases here. So where someone has been diagnosed with cancer and there is a decision made to preserve their fertility for the future, whether it's to collect their eggs or create embryos or collect their sperm, that may still go ahead. But even with those cases, because it is likely that the patient may be immunocompromised, it's again another difficult decision that needs to take place between the fertility specialist and the oncologist, as well as, of course, the patient. So anything that falls outside of that remit, sadly, is going to be postponed. The other thing that we have to bear in mind here is the person-to-person transmission. And if you were to start fertility treatment, it's very likely that you are going to need an intensive level of monitoring through sometimes daily scans or bloods, and you are going to need that face-to-face contact. Now, some of it can be done remotely, but some of it is unavoidably face-to-face. And as a result of wishing to protect the wider general public, anyone else who may be in the clinic, and also the health professionals there, again, it's recommended that this doesn't go ahead at this particular point in time. In addition to that, if we were to treat you and you were to become pregnant, but later on develop symptoms of COVID-19 or contract the disease, then there is the potential for complications to happen, which may require the NHS. And at the moment, what we're trying to do is alleviate the burden on the NHS, which is also why all elective procedures are essentially being cancelled and deferred. So, for example, if you suffer from a condition like endometriosis, that may mean you need to be operated on before you have your fertility treatment, we won't be able to do this for you simply because the situation with the NHS is that we are preparing to only deal with critical emergency situations as we try and essentially deal with the crisis that is about to hit us in the coming weeks. So there's a couple of really complex reasons I hope you can understand, which are to do with the wider sort of ethics and wider spanning implications in terms of delivering any treatment to someone who wishes to become pregnant at this time. The other advice that's been issued is that for anyone who is potentially immunocompromised due to the fact that they have a chronic long-standing health condition, it's been advised for you also to not get pregnant, certainly not through fertility treatment, but also to avoid pregnancy naturally occurring. So I would strongly recommend that you consider an effective contraceptive at this time as well in order to try and avoid becoming pregnant. For those who've secured CCG funding or NHS funding, please rest assured that every clinic will do their utmost to communicate with the CCGs who are aware of the coronavirus situation and will liaise with them regarding your funding and ensure that hopefully it's going to be made available later on once treatment does resume. So I want people to feel reassured on that front that clinics are going to do whatever they can in order to try and secure that for you, as we are facing an unprecedented situation here. And just to say that anyone who is affected by this, who has been looking forward to having treatment or getting pregnant, please make sure that you're getting the relevant emotional support of either through counselling or reaching out to various organisations, support groups, to family and friends. It's really, really important that you're looked after at this point in time. And the disappointment that you're going to be feeling, the devastation, is completely palpable for us as clinicians because we feel that pain and we wish we could deliver this treatment for you. But at the moment, we are following strict guidance, which has been made with the best of intentions behind it. And if we look at how this guidance compares to other countries and other parts of the world, so the Americans have essentially stopped doing any non-urgent treatment as well, and have recommended that all of the treatment, elective treatment and news cycles which were supposed to be done should be deferred and need to wait. For how long, no one knows. The Australians haven't been as strict with this and they are allowing general treatment to go ahead if a person is well at the moment, but then they don't have the number of cases that we do within Europe, within the UK and also within America. And the European Society of Human Reproduction has also strongly recommended that all non-urgent treatment is deferred until a later date. So we are essentially following guidance which has been issued by a couple of other countries as well. And, you know, this is really, really important because I don't want anyone to feel this is as a result of someone not wanting to do your treatment. It's very much the opposite, and that it's been incredibly harrowing for every clinic to have to make this decision and potentially cease operating under these circumstances. So I will be bringing you the latest and most up-to-date information, including the frontline and what's going on as it all emerges and comes out. I'm just hoping that everyone is okay at this time, looking after themselves. If you are pregnant, then please remember the 12-week rule by the government to certainly self-distance, but also ensure that you spend most of your time at home and limit any social contact in order to try and avoid any contact with someone who may be a carrier of coronavirus. So this is really to protect you. And even if you're not pregnant, it doesn't matter. What is really, really important and really just I can't get it across enough, fundamentally important and critical, is the fact that essentially everyone should be practicing self distancing. And this includes avoiding any crowded areas or places and limiting social contact with other people, simply because in order to get ahead of this virus, in order to try and prevent its spread, we have to do these things. And I know that they're hard. I know that it essentially means all our lives are pretty much turned upside down for the next couple of weeks. But we have to get through this really difficult period in order to try and essentially make sense of this virus and stop it spreading any further. So please make sure that you're following the government advice and keeping yourself and your family as healthy as possible, but also all of our health workers as well, who are going to be stretched to the brim. Our hospitals are going to be coping with unprecedented levels of cases. And it's really, really important that the only people who come to hospital are those who really urgently need our care and attention, because every time someone does come in, they potentially also put other people within the hospital at risk, as well as the staff. So please follow the government advice. Stay at home if you've got a high temperature or if you've got symptoms of coronavirus, and only call 111 if you are deteriorating or there are any potential complications that you're experiencing. Otherwise, please make sure that you self-isolate at home along with your family and anyone else who lives with you. And let's all get through this together. Sending you lots and lots of love.